Affordable housing was a big theme in yesterday's budget, and so were the environment and growing the economy. But many involved in the front lines in healthcare in Canada say that the budget came up short on healthcare and long-term care, two areas so hard hit by the pandemic, and two areas which the Trudeau government has promised to address. Joining me now is Stephen Staples. He's a National Director of Policy and Advocacy at the Canadian Health Coalition. Mr. Staples, thanks for joining us.
Hi, Martin. Thanks for inviting me.
Okay, let's start with yesterday. The headline out of the budget in terms of healthcare was that the government announced this $5.3 billion dental plan over the next 5 years, setting that up. And it did have a section on public healthcare in the budget documents. But for you, what was missing?
Well, I think for lots of people, there were some really high expectations put for this budget. I know that the government has been involved in a lot of consultations with frontline healthcare workers, people that I work with, whether it's in nurses or other areas or personal support care workers in long-term care. So there was a lot of consultation happening about the crisis, especially in what we call HHR, Health Human Resources, with nurses and doctors and care workers burning out, leaving the profession, and just being short-staffed in our healthcare system. So we expected that there was going to be a big boost in our healthcare system as we emerge out of the pandemic. And certainly the Prime Minister has always been saying he's going to build back better. Mm-hmm. Well, it seems that looking at this budget, it's more like build back later, because there's a lot of unanswered questions, some placeholders on some programs, and other areas are just completely absent, including trying to deal with the human resources crisis that's in our healthcare system right now.
So when you're talking human healthcare, sort of human resources in healthcare, or human health resources, those questions came up during what's called the budget lockup. Several reporters asked about that. What would you be watching for? Some sort of funding or some sort of overall strategy of how to fill what has become a crisis in many provinces?
Well, absolutely, and we do need a longer-term strategy, because we've got to bring healthcare providers in through the educational stream. For instance, we needed to create new seats for nurses and technicians and other people to come through the educational system. There's also been talk of some reform around people with foreign credentials that are here in Canada to be able to move more fast and more quickly. That's maybe a more shorter-term solution, more quickly into the healthcare system. And some of these plans have already been articulated, Martin, because in the election campaign just last fall, this government said they were going to put $9 billion to long-term care to fix the absolute crisis that we saw, thousands dying in long-term care homes. $9 billion was to go to including hiring 50,000 personal support workers and then boosting their minimum wage to $25. So where is that? Long-term care was not even mentioned in this budget. Mm-hmm. It's like they've completely forgotten about that horrible experience that we've all just emerged from.
So I'm going to echo, or I'm going to be the devil's advocate, or I'm going to parrot what the federal government will probably say, and that is that this is all pending a federal, provincial, territorial, a first minister's meeting or a minister's meeting on healthcare. Until they sit down with the provinces and territories, they can't really do a lot in these things that are predominantly provincial jurisdiction. What do you make of that?
Well, there's some truth to that, of course, because healthcare is a provincial responsibility largely, but the federal government plays a big role in it. As we know, it provides a lot of funding through the Canada Health Transfer to the provinces that's governed under the Canada Health Act to provide for health care. And the provinces have been wanting to increase the federal percentage of the overall health care costs dramatically under that program. So the federal government does play a very big role, but it can put money on the table. I just remind you of how things went right on the child care front. We got a number of agreements because money was put on the table. Then the negotiations went forward with the provinces. And so I think we can do the same thing here in these other areas, whether it be long-term care or even Pharmacare, for instance. We had been calling for $3.5 billion in this budget to cover essential medicines, the first steps of the National Pharmacare program. Put that in the window, get the provinces on side and negotiate the deals, and then move forward. Instead, we're going to have to wait a few years. But I think the urgent need is now, and Canadians are going to continue to have to pay extremely high costs for drugs. while we wait for this program to be brought about.
I was going to ask you about that because, I mean, obviously the NDP Liberal agreement, the deal that preceded this budget was that they were going to move ahead on Pharmacare. We were going to finally see announcements. In the budget, there was a mention, and the mention was that legislation would be tabled next year. We all asked NDP leader Jagmeet Singh about that yesterday, and he says he was not put out by that at all. The Pharmacare timeline in their agreement is next year, starts next year. What do you make of that?
Well, he's not wrong. In the confidence and supply agreement, it did state very clearly that there would be a process for Pharmacare, and I give full marks to the negotiators of this deal between the two parties for keeping Pharmacare on the agenda. And frankly, we were glad to see it in the budget, even though we did not get the funding there, but it was in the budget there on page 151, because as we know, it was not mentioned in the fiscal update last fall. It was not mentioned in the throne speech, didn't make it into the health minister's mandate letter, and now we see it in the budget. So we're taking steps, we're making progress. I'm an impatient guy because the one thing I know is that this plan is ready. It's been ready since 2019. This is not something that we need to figure out. For instance, in dental care, which I'm also very glad moving on, that's going to take a while to figure that system out. But on the Pharmacare front, Dr. Eric Hoskins, a former health minister of Ontario, was commissioned by this government to do a report, which he produced in 2019 that gives like back to front, A to B, C, D, all those steps to put in a Pharmacare program. This thing is shovel ready. It's ready to go. It's fully costed and it has broad public and political support. So we don't really need to wait for Pharmacare. The plan is there, but as it is, at least we've stopped the government, for the Liberals, from backsliding on it. The NDP have kept them to this plan, and we're going to work very hard. Our organization and many other medical associations will be working hard to make sure that by the end of this agreement, we've got the Pharmacare Act in place, we've got the list of essential medicines in place, and the Canada Drug Agency is up and running, and then we start getting deals with the provinces.
And all of that, of course, the Pharmacare program in 1 year. Now, just a quick question in 10 seconds or less. If so much of this, not necessarily the Pharmacare program, but if so much of it is awaiting a federal, provincial, territorial meeting on health transfers, does anybody have a date for when that might happen?
It was mentioned in the budget, not a specific date, but the importance of having these negotiations, and the premiers have been chomping at the bit for it. They've wanted to have it even before the Parliament started last fall. So I think they'll be ready for it. Of course, there was a standoff. The provinces did not want conditions put on the funding that they were going to be getting from the federal government. And the Liberals, and they stated it again in the budget, if they're going to hand over big money to the provinces, they're going to want to see what they call outcomes from these programs. Well, Pharmacare, dental care, long-term care through a Safe Long-Term Care Act, those could be those kinds of programs. They just don't want to be writing blank checks to the provinces. And that's something that we can agree with, that we want to see accountability for our public healthcare system, that we're not allowing privatization coming in, that the money is getting spent on the purpose that it's meant for, which is healthcare. Okay, well, Stephen Staples, thanks very much for speaking with us. We'll watch this issue, obviously, closely. Thanks a lot. Thank you.